So let's start. We waited enough. We will not take much of your time. We're trying to see that others join us on this call today. But apparently some are having technical challenges. So our special guest today or for this week is Dr. Yakubu Adamu. So he will declare the event open, and then if you have anything to say later, he will do that. The training for this week is titled Telecom Innovations for Public Health Practice. It's a 6-month pilot of the VIGit system for public health physicians in Nigeria titled Project 2480. It has been approved by the National Leadership Association of Public Health Physicians. So Dr. Yakubu, over to you for the opening remarks while I take this presentation.
Yeah, so thank you very much. I'm a bit discouraged with the numbers because last week I saw, the number of people, but I want to believe people are having challenges with connection. So my name is Yakubu Adamu. I'm a consultant public health physician and also an entrepreneur. I want to say that I feel honored to be selected to serve as a special guest for this week 2 webinar series that's championed by Ave Health Sense in collaboration with the VIGit platform. I want to welcome all of you and thank you for sparing your time to attend this webinar. You know, as they say, knowledge is power. We'll add the body of knowledge to you and also empower you to take. Probably, since we don't have enough quorum, I will give my personal experience at the end of this meeting so that at least more people will have the privilege to hear how I have benefited and corporately benefited from these telecom innovations. But once again, I want to encourage each and every one of you that is here to listen attentively, and please do ask questions. And at the end, I want to believe that you will partake in these innovative telecom technologies. So please sit down, relax, and pay attention. Once again, you're welcome to this webinar series. I want to declare this webinar series for this week open. Thank you, and over.
All right, thank you, Dr. Yakubu. We'll just move forward straight away and talk about the VIGit system. This presentation is generally presented by two of us, Joshua and myself. Apparently, Joshua has traveled and I understand he's having technical challenges joining us. So I will run through the presentations, and this technical aspect of it will be taken by Dan, who has been part of us and understands how the system works. So for this project, I'm the project manager and principal investigator. So first is for us to review the telecommunication industry. Now, all of us are aware that in the last few years, COVID affected the entire world. But one industry that benefited from this pandemic is the communication industry, especially the digital system. And the reason being that while every other person was sitting in one place, the need for data and communication increased. So it's now established that our economy was lifted out of recession by the benefit of the industry. So we have this evidence in documents that have been published. Of course, the table indicates, the table by here indicates that the revenue increased significantly in the telecom industry between 2019 to 2020. While every other sector was facing huge challenges, this sector was actually making huge benefits. MTN has actually talked about 1.7 trillion revenue, which was published this year. The same thing with other networks like Airtel. So all have shown evidence of progress. Now, what has happened is, with this progress, what it just simply means is that money is circulating within the industry. And this money is coming from individuals. We are assuming that if this money circulates within the public health sector, then there could be certain benefits. But we know that as we practice now, there are two things that happen to us that take away our resources. Now, the first one of them is the banks. The banks takes all manner of charges from us on a daily basis, using all manner of systems, including USSD. The insurance company takes away resources from us. Now we know that this Zoom that we're actually participating in now By the time we are done, we have taken away our data. And of course, the social media on a daily basis take away our time and resources. So the telecom industry, yes, has huge opportunities. We have experienced huge opportunities in the telecom industry. So now what we are saying is that, is it possible that a small portion of these funds can circulate within the public arena, or even within the health sector? Now just imagine that 1% of all charges the banks get on a daily basis is now used for our project. So the big question that kept agitating our minds since we knew about these possibilities was, can we look at innovative financing mechanism? That how can this telecom digital cash flow that we have seen in the last few years circulate among public health practitioners to enhance quality of their work? This is what we've been trying to figure out in the last 18 months, working on this project. It's for this reason that Ave Health Sense Limited, in partnership with VIGit Platform International, has come out with us with a system that will circulate value and create a source of income while taking care of expenses, both personal and office expenses, to address personal and office needs. So what is the solution that we have worked on? The solution is called a VIGit system. Now the VIGit system has 3 components. The first component of the VIGit system is design of digital tool for real-time data capturing of key performance indicators and feed-based monitoring. You agree with me that with increasing security challenges, it has become very difficult for us to even reach out to supervise projects in hard-to-reach areas or in security-prone areas. But with technology, it's possible. So is it possible for us to design tools to help us with this? So the first component of this is capacity to design tools, which is in-house, and these tools are used for data capturing. The second component is the virtual top-up automated telecom trading system that offers 1% weekly commission for cost recovery. Again, each time we design a system, the rate limiting stage for most systems is financing. Now, once funds are available, the projects are run perfectly. But once funds are no longer there, it becomes difficult for these projects to be sustained. So we designed this system where the system we're putting in place will be sustained by this mechanism of financing, which is using the telecom industry hugely. The third component of the VIGit system is advanced COMBOPAK basic for mini audio telehealth. Now we know that if doctors or health workers of different categories are able to be connected to a telecom system, that gives capability for us to engage each other, either as monitoring evaluation or mentoring or supportive supervision. So these 3 components is what we put together as called a VIGit system. Having said that, I would have loved if Joshua is on the call to join us, but unfortunately, where he is now, he's having huge challenges with his telecommunication gadgets. So Dan will handle the area that Joshua is supposed to handle. So Dan, over to you. So what is the VIGit system?
Hello, can we hear me?
Yes, go ahead.
Okay, thank you very much. Good evening to everybody once again. So I'll be running through VIGit Platform International and the packages they are offering to put together the VIGit system. So about VIGit Platform International, they're a registered company and that is their license there. As we all know that every company has to be licensed for them to operate in Nigeria and to run. And their license number, CAC number is there, and also licensed with the Nigerian Communication Commission. Their license number is also here, and as well as their office addresses. So in order not to waste much of our time, this first page just talks about the licenses of VIGit Platform International. So I'll move on to the services they are providing, which is aiding us to put together the VIGit system. So My Wallet Shop is an online innovative platform that rewards you cash commissions whenever you buy airtime and data. What this simply means, I'll break this down without following what is here. I'll break this down simply by saying, whenever you purchase airtime or data from your banks, the banks get a 2% commission. Now, what we are saying here is that this 2% commission can now be reverted back to you instead of the bank getting it when you use my wallet shop to purchase your airtime and your data, as well as pay your cable TV subscriptions. You get a certain percentage which is reverted back to you. My wallet shop is an innovative platform in such a way that we're trying to build an ecosystem where small businesses can grow. We're trying to build a system where we encourage people to earn from what they're using. Unlike where the bank, for example, now when the banks are getting these commissions, you don't get any reward for it, or you buy. Now imagine how many people are buying from the bank every day. That number put together, you now see the huge funds that the banks are controlling. So what we're trying to say now is we're trying to bring the system in such a way that we can have a portion of these funds being allocated to each and every one of us when we own a shop on my wallet shop. When you own your own shop on the platform, you get your own commission every time you buy your airtime or you buy your data. You get your weekly percentage commission when your shop trades of 1%, and you get 2% commission whenever you purchase your own personal commissions. So a breakdown of what my wallet shop offers: you get instant commission on every airtime or data recharge and cable TV subscriptions you make. You have the opportunity to own your personal online telecom shop, just as I mentioned, and 1% of whatever value of your shop is being offered to you every week. Every week, every 7 days, you get that commission. So for example, today is Wednesday. If you activate a shop today, at the end of this training, you get and your shop is trading, you get 1% of whatever value you activate your shop with by next week, Wednesday. You can also advertise your personal products, which are other features, and you can pay your light bills. You can get you can get items on credit and pay later from the ecosystem, from the community. My wallet shop is just a community which we are building. So a detailed breakdown of the commissions, like I said: 2% commission on every airtime and data purchase, 30 Naira commission on cable TV subscription, 1% weekly on the 7 days, every 7 days on your shop category, and then 10% bonus on your every time your referral customer purchases from their own transactions, and then you get a bonus from your referral. My wallet shop simply is integrated and it trades fully and it's secured. Now I'll talk about COMBOPAK Basic, which is the next thing and the next package which is being offered. COMBOPAK Basic simply is a simple way of connecting everyone together on a project. So for example, now let's put all the packages together and say that we are running a project. And then when we're running this project, you want to have a means of communication with everybody who is a part of the project. You can easily do that, which we're running with our 9Mobile license, which we have gotten with our third-party partners, 9Mobile. All they are simply saying is once you recharge 1,000 Naira, you can simply contact each and everyone on the project for free throughout the whole month. All they are simply saying is 1,000 Naira recharge, and you can contact anybody on the project for free. So we are bringing this in. And how is this funded? You can simply have your shop trading, which is going to be funding this part, and then everybody is communicating seamlessly. There's no interruption in communication, you understand? And this is done through integrations. Can we have next? Through integrations, through Flutterwave, and all the banks are integrated on my wallet shop as well. And 4 major networks: MTN network, MTN, Airtel, Glo, and 9Mobile are all integrated on my wallet shop. So for each and every one of these, you get their airtime and their data purchased on my wallet shop. So I think that is just a simple breakdown of my wallet shop and how it is integrated together with the COMBOPAK Basic to enable us have seamless connection and seamless flow of our projects when we run them. So I think Dr. Kenneth will take over from here. Thank you very much.
All right, thank you, Dan, for taking that presentation. I'm sure Joshua may join us later when his connection is perfect. But thank you very much for that wonderful presentation. So let's now look at the project implementation. So what does it mean? Before I go into details of the project implementation, I want to put emphasis on what is happening with Team Public Health. One, we've had increased costs with the same salary. Nobody have actually increased anybody's salary because costs have increased. No. We have little hazard allowance, despite all the The issues we have faced with COVID, the allowances have not changed significantly. We have inadequate funds for interventions. Most our projects are suffering from lack of funds. There's need for monitoring evaluation of hard to reach areas we have for either security reasons we can't reach. So technology is able to help us reach those areas. There's need for supportive supervision. Now, security risk for how to reach areas has become a major issue. There's no need to lay too much emphasis on this, but that is the reality. Now, of course, every day we have calls. These days, there's no day that you don't have Zoom calls, but nobody is giving us Zoom allowance or a communication allowance of any kind. So the question is, how can we address these issues within ourselves and then using Telecom as a platform? Now, the justification for this project was part of the communication issue that the last conference was lowering, which recommended that we should have digital interventions and work with agencies of government to set this up. Now, it's important that we should be left behind when it comes to the issue of digital platforms. So what is the project assumption? For every project, there is a hypothesis or the question that you ask, what is the research question? Now, what we're talking about here is what is the project assumption? We're making this assumption that increasing the circulation of telecom funds among public health practitioners will improve and enhance the quality of their work. And it's based on this simple equation that technical know-how to skills minus finance equals to frustration, which means that no matter how much you know, or how much capable you are, or how much capacity you have to do anything, if the resources to do that is not available, then you have challenges. So what we're saying is that if 1% of the fund within the telecom industry is circulating among public health physicians, what will happen differently? So this is what will happen differently. So if telecom, if you have technical know-how and skills, and then of course, finance is added to it, it means that so much of what we want to achieve will be achieved. And that excitement will come natural because for the project you want to do, you will do them at a very minimal cost, or you have a system put in place that will sustain the efforts you want to do. So what is this project strategic plan? That for the first 4 weeks in May, we'll be having this meeting for training Wednesdays and Sundays by 8 p.m. While we choose this time, we expect that people would have been at their locations by this time. Then we're also going to activate my wallet account for at least 5 members of Association of Public Health Physicians per state. We're also going to conduct digital tool training for interested states. For instance, those who want to learn how to design ODK or design other form of digital tools, we'll have them trained either physically or virtually. We also deploy mini audio telehead for selected states or institutions. So for states that institutions that want this test run in their facilities or in their state, then we can have that done. Of course, we continue to deploy the VIGit system in states that are interested. So the essence of this is to now provide information. So the project cycle is for 6 months, and this is how it runs. The first 4 weeks, we will actually be doing this training every week. Each week, we'll have a special guest who have an understanding of what you're already doing. We'll now activate 5 members per state from May to July. So we'll keep activating people who will test run the system. We will now have digital training from May to October. So the stretch of the 6 months, we are open for any institution that wants to learn how to design digital tools at no cost to them. And of course, deployment of mini audio telehead will also take place May to October. Then deployment of VIGit system will be a continuous process. As the states show interest, our team initiate the process of that deployment. Then after the 6 months of pilot, we're going to do project evaluation in November. And then of course, we'll write the project report in December and present our findings at the next APHPN conference holding in Rivers State in January 2023. So what are the basic needs of any project? Now, if you have any projects, these are some of the needs that you cannot avoid. First is power supply, bills. So NEPA bills will be there. You have communication bills. Of course, power is never always there. So you also have fuel. Fuel may be for your generation, for your vehicle or whatever. There's also a fund for office maintenance. And of course, Zoom has become part of our routine life. So what we are saying simply is that These are necessary project expenditure. So what do? You estimate this expenditure for 12 months. Now, whether you like it or not, at the end of 12 months, this money is not returning back to you. Neither is it returning back to the system. So with the system we are building, you simply calculate what is your monthly expenditure, multiply it by 12, and then get a particular shop that is capable of trading at 1% weekly and supply the need for this. So simply you do the estimate, sum it up, and then of course you get a shop that will help with that trading, and they will now finance your need for either the project or individual needs. So what we are saying is you practically operate on zero overhead cost, because at the end of the day, the system is trading and giving you the resources that you need to implement. So when sustainability is viewed as being a matter of survival for your business, I believe you can create massive change. So we need to look at what is involved for us to sustain our project. And at this level where we're having economic crisis, every kobo matters to everybody. We need to see how much of these resources within the telecom industry can circulate within public institutions and help us address some of the challenges we're facing at the moment. Now, I keep saying this, making this statement at all opportunity. I said it all the time, that technology does not reverse itself. I remember when we were in medical school, we were looking for a telephone to make calls, and usually you travel long distance to go and use telephones of those days. Now today, everybody has a device. We cannot return back to the situation where we were looking for where to make calls, because technology never reverses itself. The same thing, why technology now is taking away resources from us. Remember that it's taking away these resources to someone else. So the money that we are going to spend on Zoom today, someone else is going to gain that money. The money we're going to spend on WhatsApp on a daily basis, the data that is consumed, someone else is gaining that resources. Now, the point we are saying is that we should not only be consumers, we should find a way of playing within the industry where resources circulate among us, so we're also gaining. So the VIGit system, as described, will help us with digital monitoring, will help us with sustaining the system for each state, and of course, will help us provide effective close monitoring and supportive supervision in selected states. How does it work? First is the deployment of soft copies tools for monitoring and evaluation. So we design these tools. So any tool that you have, be it questionnaire, be it checklist or whatever, once it's available to us, we'll help with that design. Of course, we design and deploy this tool real time on devices. Now, we create data monitoring dashboards for supervisors and leaders in their various offices. And of course, where you have EOCs, you can actually make them operational centers for some of these things we are doing. Now we build the COMBOPAK package and automate the trading system behind, so that you now have resources to finance the COMBOPAK basic, which is like a closed user group. So you know that if I've used closed user group for any organization, you know that every month there's a payment for it. But what the issue is that once the resources to finance are not there, you can't sustain that. So we're building this system so that it can automatically finance that. Of course, our team is available to provide technical support throughout the period of the project and beyond. Now, the benefits have been listed here. We know that with the VIGit system, you have clear data and accurate data, real-time data arriving at a very minimal cost. Of course, it's helped with work that we are all doing. Of course, the data, the accuracy of data is real-time. Now, what are the projects? This is what everybody will want to hear, and limitations. For every project you are doing, there are challenges around the line. So what are the ones that we are emphasizing that we will face? The first one is changing government policy on the use of virtual top-up system. We know that we're financing the entire process with the automated trading of the virtual top-up system. So what today government says, okay, we're reversing to paper-based top-up airtime. That will become an issue. But I've mentioned that before, that technology will not reverse itself. So it'll be difficult for the government to work overnight and say, look, we're reversing back to where we used to buy airtime with cars and things like that. The second thing that can actually be a risk is alteration of the telecom value chain incentives for virtual top-up. Yes, with the COVID, most of the telecommunication made a lot of money, especially from data rather than voice. So if they decide to change the incentives within the value chain, yes, the percentage for that will also change. Now, of course, policy change on the use of closed user group. It's not every telecommunication company is using the closed user group. The reason being that most of them that are making more money from data are moving away from investment in costs rather than this. So they may not be interested in that. Of course, there's also a limitation of network coverage. For where the network coverage is poor for a particular telecom industry, then it will be challenging to deploy all the aspect of that. It will require us to reconfigure and look at what is on ground. Then another challenge that is very obvious that is happening on a daily basis is the rising cost of Android phones and dashboard accessories. Because of dollar exchange issues, we keep seeing the price of these commodities or accessories increase on a daily basis. And you know that every day the value of dollar changes. So where are we going to source for funds to implement the VIGit system? Now we are proposing this possibility. Philanthropists can actually support the digitalization process. For now, a lot of people are out there who will be willing to say, look, let me pick up your bills for this particular process. We also know that we can get money from budgetary allocation by states if we share this as part of the budget that, look, we want to digitalize our health systems, and this is what one of these we want to pilot. International donors are also looking for opportunities where they can make contribution. So it's possible that you can get funds from international donors to support this idea if the proposal is written, and we're available and willing to support the writing of such proposals. Then, of course, donation of device can also happen by manufacturers or distributors. Those who are distributing funds may decide to say, okay, they're supporting a state with this number of funds to digitalize their system. Now, of course, we have health insurance scheme in some states now. This can be part of what you know, add on the project. So what is the action plan? The action plan starting is for 5 public health physicians per state to subscribe as early adapters in the my wallet shop platform, and then test run that for 6 months. Then the primary care board of various states where we are providing leadership can also pilot the audio telehealth and mentoring system. Then, of course, you can scale up this model through cycle of influence or the so-called respondent-driven sampling method. And I'm aware some of us who are on the platform have already used this system, so we will also be willing to share our experience there. Technology will never reverse itself, and we need to actually buy into this and see that we pilot this and showcase to other colleagues. This is the cycle of influence model. So we are saying, look, with 5 people coming into the system, they can simply be the first five seats. And these 5 seats can be users, can deploy it and stuff like that, and of course share with other people, which is optional. But for this particular project, we're expecting that every state that have an association or have members can actually activate and start using the platform. Now, of course, the law of diffusion of innovation has played out in almost every innovation. So we are looking at ourselves as the innovators. So for those who want to participate as early adapters, it simply means that you can come to this system early, and then you can be the people that will actually be promoting the system as we grow the system within the public health system. So this is the project code. The project link will be shared in the chat box for those who want to sign up and register now. And of course, we will now take questions and do demonstration once I'm done. Now, before I round up, this is where we are. So every week we started, we activated the project last week. It was led by the national president. And this is the update that we promised to be providing every week as we progress, and subsequently every month until the 6 months are done. So as at today, this morning, these are the states that have already signed up into the system. Plus 2 states have signed up, 2 people have signed up and activated, 1 has signed up is yet to activate. So we're only expecting additional 2 people from plus 2 states. In those states have 1 person who signed up and activated the account. River State have 2 people who have signed up and activated the account. We're expecting 3 people. Kaduna State have 1 person who have signed up and activated. Bayelsa State have 1 person who have signed up, but that person is yet to activate. In terms of the VIGit system, we've started discussion with Adamawa State to see how we can package the proposal for them. We also started discussion with Yobe State for the same purpose. Of course, we're looking forward to additional states who will show interest, and then we can now design the project for the states. In conclusion, I want to say that once social enterprise have a diverse and stable set of income stream, they are better placed to have greater social impact. This saying is from Dan Zastani, who is one of the social enterprise experts. So what we are trying to do is that public health is our calling, and public health is what we do, but we need to see how this can become a social enterprise. And what is the social enterprise? A combination of charity activities plus small profit that can enhance capacity for these projects to be sustainable. So we're saying that if 1% of resources move from the telecom industry and circulate within public health institutions, we should be able to establish wonderful enterprise. We have a technical team that can support us 24/7 with the VIGit system, and of course, the one that is supporting on this research, we have Stephanie. And of course, Dan that I've just taken the presentation we listened to is also part of our technical team. This is our address. You can reach us within weekdays. And of course, you can also send a WhatsApp. On that note, I want to thank you very much. We can now take comments from and questions from participants. Then we can do a demo. Then we'll round up. Thank you very much. So questions and comments. Joshua, are you there?
Yes, I'm around. Sorry, I had network issue, but I've joined later. So my apologies.
All right. So Dan was available to take your presentation. So you can hang out now and hang around now and take the questions that are specific for you. Godwin, any question? Ruth, are you with us?
No, sir. No, sir, it's clear. Thank you, sir.
Ruth, are you with us? Suleiman Bashir?
I think a big shout out to Dr. Tolufake for joining this webinar series. You're welcome, sir.
Okay, still Gafake, yes. All right, so if there are no questions, we'll just do a demo.
Thank you very much. Thank you.
If there are no questions, let's just take a demo, then we can round up. Yakubu will give us the final words and we'll round up. What you simply do to us is send your telephone, your details, send us your details with your phone number, and then of course, your location. You can put that in the chat box. But for the demo, we want anybody who will likely done. Okay, so you can send us your phone number and network. What we're trying to do is to do a demo of the system that we just shared with you. So just send in your number and network so that we can buy airtime on the platform while we're here. And of course, if you get to your phone, just indicate that you have gotten the airtime. Let me have the number. Are we together?
Yes, we're together.
Okay, network is very bad at my location. All right, just send us, I'm trying to do a demo of purchase of airtime. The network is fluctuating. So send in your phone number and network for airtime for the first 3 persons. We're trying to do that here. It appears the network is terribly bad now.
I can help you out if it's challenging for you.
Joshua, do you have a better network?
Yeah, I said I can help out if it's challenging.
Oga Yakubu can help up. I think it's better because mine too is having an issue. So maybe Yakubu, if Yakubu can share his screen.
Yeah, can you allow me to share my screen?
Right.
And Dr. Kede, can you hear Yakubu? Sorry, Dr. Kede, can you hear Yakubu? He says you allow you to share. Okay.
Okay.
Can you see my screen?
Okay, yeah, yes, I can see your screen now. Go ahead.
Okay. Yes. Okay, so let me log out. I need another one.
So you can send in your number, your phone number. Yakubu will simply use a platform, and then you will see airtime purchase on your device. This is a system that we're using to power the VIGit system, so that it's practically running the whole system digitally at little or no cost.
Yeah, so can you share your telephone numbers and network, and then I can go ahead and credit your telephone lines. The first three individuals.
If you're active on the platform, just send in your number and the network. If your number is MTN, okay, Yakubu, you can pick Bashir's number is here. I know it's MTN, so pick Bashir's number.
The one that ends with 5014.
Yes, yes.
Sure. All right. So so you can see I've put that number. It's MTN. I think we have upgraded to giving 1,000 rather than 500. So you will have two options, either to pay through the bank transfer or your wallet. So I'll go through my wallet because I already have money in my wallet. You click the voucher wallet and then you pay. So automatically you will get a response that says successful. Once that response comes on, meaning that you've gotten a recharge card. So please, can you confirm if you have gotten 1,000? Then I'll go to the next person, which is Muazu.
Exactly.
Same MTN line. Sir, can you confirm if you have gotten 1,000? Bashir?
Just go ahead. Bashir, we will confirm later. Muazu is here.
Yeah, so I'm doing Muazu. It's also 1,000 naira. So the same process, go to my wallet and then make a payment. And then we'll go to the root that refused to acknowledge and speak to us. So Muazu, please, can you confirm if you have gotten airtime on your phone? Yeah, all right. So he has acknowledged that he has gotten 1,000 naira. We're also going to do the same with Ruth, but I think for Ruth, we want to hear her voice. Strange. I don't know what happened. Okay.
All right, thank you, Muazu. So this happened. Oh, okay, Bashir.
Yeah, for some reason.
Yes. Bashir have
Yeah,
just
so
posted
for
that he's gotten his.
Yeah, so I'm having challenge with the last one. Yeah, for some reason. All right, let's see if it will go. Okay, I think it went. Please, can you confirm? I can also check from here. I'm not sure. I'll retry again and see.
The glow.
Yeah, go ahead, Joshua. The glow line.
line looks like 9 mobile unless it's
Yeah, please, can you confirm? Because I had that switch, so I thought whether the error is coming from the network.
Just try it again. If it doesn't work, it will reverse.
Okay, cool. Okay, so it's the same error that we've gotten.
Okay.
All right, so I think over to you, Dr. Kenny.
All right, thank you very much, Yakubu, for the demo, and especially for giving us airtime. We appreciate. Bashir has actually sent in to confirm that he has gotten that. Moazu has seen that done. The glow line maybe most likely has issues. But Ruth, let it be on record that we are on you airtime of 1,000 naira, so you can send in another number.
Sorry, Dr. Ken, the glow line looks like 9 mobile unless it's a ported line.
Okay. Ruth, are you there?
Looks, it's a 09, it's a 809. So
Ruth, are you there? We are seeing 09 here. If it's a glow line, let us know. If the network, if the number is not with the same network, it does not work. All right, thank you very much.
Good evening. Can you hear me?
Hello, I can hear you very well.
Okay, great. Good speaking. Thank you. I saw the demo and I appreciate the effort. Yes, it's a ported line. I ported from
It's a ported line. Okay.
9 mobile. Yes. To Glow. So maybe that's where the challenge is. Yes.
Okay, it's a ported line from 9 mobile to Glow, right?
Yes.
Okay, so that is why it's having the issues. It's okay. Thank you very much for joining us. If there are questions.
It does not, but maybe we'll just give it a try again, but it doesn't supposed to affect the network. It doesn't matter, but maybe they'll give it a try again and see.
Okay.
Whether off the Zoom is still okay.
Okay. So Joshua is now on the call. Joshua is the anchor telecom person who has helped us support this program. So he's here. I will allow him 2 minutes to talk to us. Already the presentation on his slides was taken by Dan, but for him to talk to us for a few minutes before we can round up. So Joshua, please, you have the floor, 2 minutes. Then if there are no questions, you can round up.
Okay. Okay, good evening, everybody. First, my apologies because I traveled and the place I came to, the network is not very strong. So I've been trying to move from one hotel room to the other, trying to see where I can get strong network. So I missed the other part, but as Dan must have explained, my wallet shop is simply an automated VTU trading system. So that's all about it, and it's an e-platform for e-commerce services. So you have many other things you are doing on it. It helps you to take care of your bills in the office, your NEPA bills and the rest, which I met Dr. Ken talking about it, and your salaries and stuff. So with a shop running for you while the system is selling to the community, the commission you get weekly takes care of all these things. So you don't stress yourself on how you are going to run your office, even if the bills are increasing, because you have something that is taking care of that. So that is just the concept for the public health practitioners to leverage on the ready-made market in the telecom sector and then make some good income for their day-to-day office expenses. Thank you. If there is any other thing, maybe if there's a question, we can now respond to that.
Okay, Joshua, thank you very much. Thank you very much. Are there questions for him? Otherwise, we should round up and call it a day.
Good evening. I have a question.
Go ahead, Ruth.
Thank you for the presentation. I must admit that this is somewhat new, But like you said, technology grows upon itself, so it's definitely highly welcome. So my question is this system supposed to work as an app? You know how we download apps on our phone and we can access the items through the app, or it's something that should be installed in some other way, or how exactly does one get access to this VIGit system? That's my question.
Okay, I can respond, right?
Go ahead.
Okay. Yeah, for now we're using the website. So for the few years that we'll be running it, we'll be running it on the website. We actually developed an app, but the app had some security challenges, which we did not launch it. So we took it down. So we're still working on it. And with time, the app will come up. For now, we are dealing with the web. So it's www.getmywalletshop.com. So once you type it, everything, just the way Dr. Yakubu has just displayed or shown when he was buying airtime, it will just come up for you to put your ID, that's your customer ID if you have registered, and then your password you created and everything. It takes you into your account, your wallet, where you see your back office, where you see every transaction menu of anything that you want to do. It is there. You can pin it on your laptop, or you can save it on your bookmark on your phone. Anytime you just click on it and it will open. So instead of typing www. So it's a website for now. I don't know whether that is clear. Okay, I think they are typing the link for you on the screen. Okay, this is the registration link, but the first part of it, www.getmywalletshop.com, is the web where you can see everything, you can read everything, you can click on register, or you can equally log in after registration subsequently. Okay, you can see it placed up. So that's just the link for your airtime or any other transaction you want to do in your wallet, having your shop, advertising the product, buying anything on the product, telephone on the website or any other item. You see everything there. Once you register, all these things are available for you at a click using that getmywalletshop.com.
All right, thank you very much. There's another hand up.
Sorry, I have another
Ruth, have we answered you?
Yes, you've answered the first one, but I have another question.
Go ahead. Go ahead. There's another hand up. Go ahead.
Thank you. So this is clear, but I think in the demo that was shown to us, we only saw how the recharge was made, and yes, it was acknowledged, but we didn't see how are the tokens gathered, or the units, what you have at the back end, that is used for you to pay for some other things. We didn't see how it gathers, on that person's back end, or where does it reflect? And how are those tokens used eventually? How can they be used to help you in the future?
So I've just posted the link to the portal. Some of the questions can be answered if you just click on that portal. All the details about what we discussed is on the portal. If you need additional information, the information are available there. Okay, Yakubu is there. He has also shared it.
Exactly. The question Madam just asked now, she wants to see other wallets. I'm sure he wanted to see how the commission that they just purchased, how it moved, maybe because of time. The first one, it was, you showed how much was left, and when you bought it, something added. Maybe she wanted those details.
Yes, that's what I'm
Yes.
And then
okay,
how
so fine.
the commission can now eventually be used.
That's okay. I can help you do that. So because of this question you've asked, You can see my screen. You can see that the commission here is 750. I'm going to load an airtime to a number 35927.
But I use my number now.
Yes, I'm using your number. Okay. So you can see, so 2% of 5,000. What's 2% of 5,000?
2% of 5,000. That is 100.
Good. So it was 750. And then now we'll go to the dashboard. You can see it has turned to 850. Does that answer your question?
Yeah. Great.
Okay.
So how does 850 help you subsequently?
Yeah, so there are two ways to it. The first one is the recharge card. By selling, you are getting commission, and that commission is adding up. The second is that you have a shop. So I have a shop of 500,000, and every week I get 1%. So 1% of 500,000 is how much?
5,000.
5,000. So at the end of every week, 5,000 will be added to this. This is what I withdraw into my account to pay either for my staff or to pay for light bill. So you can see that it's also electricity bill. I can also pay for a TV subscription. I can also pay for data or voice, as the case may be for my projects. So this commission, of course, you can have multiple shops. You can have a shop up to 1 million naira. So as Dr. Kenny has said, you need to calculate what your expenditures are per month. Once you calculate that, then that will tell you, and then 1%, what does that translate to when you open a shop to be able to cover that. So that is the calculation that you need to do to be able to see how the shop will pay for that overhead cost. I don't know if that is clear.
Now, remember that this 500,000 you are seeing here, at the end of the expiration date, this money is back to you. Look at the shop that Yakubu has here. This shop is expiring in December 06, 2022, which means in December, this 500,000, after trading for 12 months, is back still available for Yakubu to either withdraw or roll back again. So that is why we are saying that invariably you are actually eating your cake and having it. The funds are there. They trade the same way it's trading in the bank. If you buy a time from the bank gets 2% on each of the amount you buy, which Yakubu has just demonstrated to you now. So the same thing happens here. But of course, you have deposited the money in the bank is using the money and using the commission. Here, your system auto trade gives you the commission. At the end of 12 months or 6 months, as the case may be, your money is back to you. You have used the commission funds to finance the project, to finance the overhead costs. That is the essence of what we're doing here. And of course, why are we bringing the public health practice? Again, there's so much that's happening within our practice that require this type of system. If you are going to have a sustainable CUG system, you need a system that can finance it for that duration. Ruth, have that answered you? We should be running up now.
Yes. So
if I have more calls, if I have more questions, you can put them in the chat box.
I'm focused on the shop wallet now.
Hello?
On the shop wallet. So for instance, Yakubu has 500,000 naira in the shop wallet. So you're saying that at the end of every week, a commission will be placed on that amount.
1%. And 1% of this value. 1% of this value. How I wish my data is strong now, I would have done the same thing to demonstrate on the platform, and the account has been set up for this project. It's 1% of that value that you do.
Okay,
we can
so
answer
maybe
questions tomorrow. Put your question in the chat box so that we'll have the opportunity to answer the next person's question.
So I will just open one so that she can see. So you can see this account. It has a commission of 107,500. So this is one of our project accounts that we have used. We have not actually used this. Usually what we do, we have several shops and we take every shop every month. So we have 6 shops. This shop is due by the end of May. So by the end of May, when we have probably gotten 107, we're expecting another 15,000 thereabout. So when we get to 120 something thousand, we withdraw this commission and we pay our bills for the month of May. So by that time, our 6th shop will also be accruing similar amount of about 120, because we found out that our project cost, it's about 120 monthly. So for us to do that, we need to generate 120,000, and we needed 6 shops to be able to generate that amount of money. And so that's why we've opened 6 shops. So that tells you, you know, how much money you can have and how you can finance your project. Thank you, and over.
Thank you, Yakubu. You understand this system very well. For your information, he has been with us for long duration. Who else? Ruth, you can take more of your questions even after this. My number is available. Your number is there. We can talk personally. If you have issues, you can address them. Can we have the next question?
There is BioPrevent. So we
yes,
don't know.
BioPrevent Health lecture series. Go ahead.
Yeah, thank you very much, and good evening all.
Go ahead.
Thank you, Doug.
Yes. Okay, this is Dr. Adam Dawood, actually. Now, it is so interesting, and one is used to other aspects of these transactions, really. But the way you said you are using web, you know, the problem with web is sustainability of network. So if now there is an urgent need to make transaction and the network is down, there will be challenge. Is there any form in which the transaction can be made offline? That is the first question. Number 2, if you are in a place that you are solely dependent on your wallet for transaction and network has failed you, there is no way you can actually effect it, can you by any means refer to get cash and do your transactions? Thank you very much, and over.
All right, thank you very much, Adams. The first question to answer you is that yes, if there's no network, there's no way we can transact this. It's a digital-based system. It's just the same way the bank is trading, the bank is transaction business. Of course, if you go to any bank now and the network is down, the first thing they will tell you at the counter, they will say network is down.
Okay, are you getting disconnected? Okay.
Hello?
Yeah, I think he's having the connection issues. Can you take it over?
I'm listening.
Okay, thank you for that question.
Hello, can you hear me?
Yes, we
Yes,
can.
I can hear you. I'm listening.
Okay, so what I was saying is that one, like even the bank now, if you go to the bank and there's network problem, they will tell you that their network is down and there's nothing they can do about it. The same way if you go to ATM card and the network is down, you can't withdraw money. So the issue is that this system is digitalized. So if there's no network, it means you cannot move money from the platform to any of the system. But that does not mean that the system is not trading. The fact that the bank in your branch, in your state, is not functioning does not mean that the entire bank network is not working. No, a branch may not be having issues, but other branches are working. So once you have a shop here, whether there's network or no network, the trading is going on while you are sleeping. It's only when you want to move money to your account that you require network for that to happen. But if, for instance, I am somewhere in a place where there's no network and I need money, I can simply ask someone elsewhere to say, look, help me, I don't have network, move money to my account, I want to use this. and I send the person my link and the password, the person will simply load my phone. The same way Dr. Yakubu is in his house. He is in his house. He has network in his house. He has used the platform to load somebody's phone number with airtime. We don't know where those people are located, but the people are able to get the airtime that was sent to them. So the fact that you don't have network in your location does not stop the system from trading, but the system is digitalized, so it requires digital system for it to function.
So Dr. Kenny, I think I would like Joshua to chime in here. I think it's bordering on, if we can get, the app, it's a bit easier and you can use the USD code sometimes. But I'll allow Mr. Joshua to chime in. Please, Mr. Joshua.
Exactly, that's where I wanted to come in. Now, just like in every system is a work in progress. So I usually emphasize this because you can't wake up one day and have all the systems built at once to a final point. So the app, as I was saying earlier, is coming. The reason why the app delays that if you know the work of an app is more security sensitive than a web. The web is more secured when you talk of attacks or hackers than an app. So for the issue of when you are offline, maybe there is no internet where you are staying, the USSD, we don't have the USSD now. We applied for it, but the hurdles getting that USSD is not that easy. So we're giving it time because the banks and the other bigger platforms like InterSwitch, they monopolize that USSD. So that's why most of the times you see the USSD is either the banks or maybe multi-choice or InterSwitch. Because the requirement of getting that, some of those things are, they will tell you so much in hundreds of millions for you to meet some criteria. So for now, we apply, but we put a pause on the issue of USSD because we could not, and we don't want to share USSD for whatsoever reason. We want an independent USSD. So for now, the USSD is not there, and that's why we're making do with the app, with the web. The next phase is the app. Once we settle the security challenges, the app will come up. Now, my wallet shop looks very simple at the surface when you are operating it. The portal behind is very complex and it's very heavy. That's why the first app that we built could not carry some of the security the policies that we wanted. But that is coming on board. So for the second part of the question, in case you want to move your money, you can always move your money. Once you have the internet, you can move your money to your bank and they tell somebody, just like Kene was explaining, to buy something for you somewhere, or if you want to move your money and do something. But for the purpose of buying airtime, using my wallet shop, you for now need internet. That's why it's a digital kind of system. If you're off digit, the USSD is not there yet. So we have the web, which has to do with internet, or you move your money to somewhere which you can transfer, just like Yakubu explained. That 100 and something can be transferred to a bank instantly. So if you have a way you transfer to bank, you can now maneuver and do any other thing that you cannot do on my wallet shop with it. I don't know whether that has made some sense.
Yes, it has really. So it's the platform is user friendly. Thank you very much and well done all.
Thank you. So just post in your name,
sir.
telephone number, and location so that we document this as part of the project. Post in the chat box your name, your phone number, your state, and email address. We are documenting all this so that we make presentation to the leadership and it will form part of our project documentation. Muazi, your hand is up.
Yeah, good evening, everyone. My question is regarding the top up and airtime. Based on what you demonstrated, it has to be one line at a time. So if you want to recharge 400 persons at the time, how do you go about it? Is there a provision on the system or it has to be done individually? Thank you.
Yeah, so on the platform,
okay.
Hello?
We are working on that. Okay.
Okay, Joshua's network is bad.
Yeah.
But at the moment,
Yes, say something. No, if you want to say something, go ahead. Then I will now maybe just round up with my own response.
No, go ahead. The response is to you. Hello? Okay, so let me respond. He's having network challenges.
For now,
at the moment, it's only one.
If you want to do multiple recharges at a time, that has not been integrated.
Hello? So, Mozu, the answer to your question is that at the moment, there is only one, you can only recharge one line at a time. So, which means if you have 10 lines, you have to just list them and use a laptop and copy and paste the same way Yakubu did. And then, of course, you do that very fast with the lines available. But as the system progresses, we are looking at options where if we are going to have a CUG for 100 users, it will simply mean that we'll have an Excel sheet with all the numbers built into it. So once we want to fund that and the funds are available equivalent to that number, you simply pick up the funds and fund them. But at the moment, it's only one line at a time. Mazu, does that answer you?
Yeah, it does.
Okay. Thank you very much. Any other questions?
Okay, yeah, still on that, if you're doing it individually, is there a way you can make it recurrent, like monthly? Or you have to go through the process all over again?
No, so what we have done, the same, what we have actually is what we do here. So we have the numbers in an Excel sheet. For instance, if you want me to be loading 100 numbers for you, or even 10, all you need to do, the numbers are in an Excel sheet. In that Excel sheet, the serial number 1. So all the numbers are there and their network are already there. So what we simply do is that when the time for that particular, assuming that the schedule is for every week of first week of the month, we simply open up the platform and pick any of the shop that has forms there. We copy the number and put there, click the system pay, and then we'll copy like that until the 10 numbers are done. This is an assignment that anybody can do within 2, 3, 4 minutes and it's done. So for now, that is how we're doing it. But of course, as the system expands, there will be options where we can automate the payment for that. But remember that the initial plan is for the trading to be giving us commission, not that you are putting up to be funding other lines. So as we make progress, we are getting that set up into the system. Hello?
Okay, thank you.
So now if we want an automated system, there are 2 ways. For instance, if the trading has given you 50,000, for instance, and you want to fund any other project outside, all you need to do is you can equally have an arrangement where that telecom facility can be provided to you independent of this platform. But we're working on everything of integration of those systems together. Thank you very much, Mwazu.
All right, Dr. Kenny, I think it is well time spent. This is 25 minutes of the hour. I think we need to round up and close. So in my closing remark, I really want to appreciate all of you for your patience. I know that we have gone 25 minutes above the hour, but I think those questions that were asked were really very important questions. Some will, they are development in process, but the others are things that are in view and will also be taken into positions. But just to mention that Ave Health Sense is a one-stop shop that can actually help you with your projects. Either be the research project or you have an implementation that you're doing, they can create a database for you, they can create electronic data collection tools. They can support you monitoring evaluation. They can even support you with proposal writing. So that's why I call it a one-stop shop. And they have actually integrated it with a digital platform that can make it to have your projects at a zero cost. In fact, I like the phrase that said, reposition to take possession. So I think I will encourage everybody that is on this platform, this webinar that has listened, to actually sign up, either corporately or as individually, because I mean, there are bills that you also settle as an individual. So on that note, I thank you very much, and I want to wish you a pleasant night rest. Thank you, and have a good evening.
All right, thank you very much, Yakubu. We look forward to see you again on Sunday. We're open 24 hours for questions, either by WhatsApp or through emails or chat. Our team is here to support everybody. Thank you. Have a wonderful night.
All right. Bye-bye. Good night.
Bye-bye.
Yeah, bye. Good night.
Bye-bye. Good night to all.
Bashi, I'm calling you after this call. Bye-bye.